Okay, well, welcome to this product demonstration video, which we're going to show you how to use the advanced LH brand of ovulation test strips. Now, these are extremely accurate. They're certified at 99.98% accurate levels by the manufacturer. Packs are available with either 10 or 5 ovulation test strips in them. Most of the packs we recommend you buy a minimum of 10 ovulation test strips, as that should be adequate for all but the most irregular ladies to see them through a cycle of ovulation. These test strips are individually foil wrapped. If we show you the contents of this pack, inside you get a manufacturer's instruction or data sheet for the advanced ovulation test, and in this pack we've got 10 individually foil wrapped LH test strips. Now on here you've got all the normal in vitro diagnostic certification marks, the CE certification and the EU rep cert 0123 in this case, and on the reverse you've got quite a nice, if small, print, but it's still everything there you need to actually be able to complete your testing. So to do one of these tests when you're ready, and we do recommend that the urine sample should be ideally collected at the same time each day. Best time to do this is late evening when you've returned from work. If you collect your urine sample too early in the day, you may miss the LH surge that's occurred that day. So I'm just going to show you one of these. Remove the test strip from the foil. Inside you'll find your little desiccant pouch, which just keeps the test strip in prime condition. And here you've got one of our nice pink LH advanced LH test strips, LH on the handle, maximum dip line indicated quite clearly there. Just going to take this off camera and put it into a sample. You don't want to dip it any further than the maximum dip line. As soon as you can see some pink dye coming up in the mid area of the test strip, as you can see on this one, it's perfectly okay to remove it from the urine sample. 3 to 5 seconds is the average. Lay it on a flat surface, and now you're waiting for that test line to run all the way through in the mid zone. Now you're looking for the development of a control line, which will form in the top 5 mils of that flattened central section, and then we're looking for the presence of a test line, and we're looking for a test line which is as dark as or darker than the control line to indicate an LH surge. Now for most of the month there will not be a surge in LH, and there will not be adequate luteinizing hormone in the urine to give a positive test result. It's only in the run-up to ovulation that the luteinizing hormone peaks, and that will give you 24 to 36 hours notice of when an egg's about to be released. The first indicator of this, first positive test, is that timing. It will remain positive for several days after you get the LH surge. That's perfectly normal. The period for which it stays positive, how long it stays positive, is of no real importance. It's the timing of the surge which you're looking to detect with LH tests. You can see on this test we've got a nice control line but absolutely no test line, which is a relief, indicates I'm not ovulating. And you would basically, we give with these in the data sheet an indicative start date based on your previous average cycle length, and you test for a couple of days until you've detected your LH surge occurring in a cycle. May not occur every cycle, again that's perfectly normal, but as soon as you get the LH surge detected, stop testing. You aim to try and time sexual intercourse to maximise your chances of conception over the next 24 to 36 hours, and then if conception doesn't occur, restart testing the subsequent month. So that's the advanced brand of LH tests. We've been selling these tests in the UK now for over 10 years. They're extremely popular because of their reliability, accuracy, selectivity, ease of use, and the fact that they're good value for money. It's alright buying cheap tests, but if they don't give you accurate results, then you wasted your money. These do give you really good, easy to interpret, accurate test results. But just show you that test and control line area. You've got a lovely white background on here and a very clear control line. So the interpretation and reading of the results is really very, very easy to do. That's the advanced brand of luteinizing hormone LH tests.